Welcome back, viewers, to Faith and Discipline podcast. Our topic today is acid reflux, and our guest today is Dr. Ghazanfar Ali. He works for one of the NHS trusts in the UK. Welcome, Dr. Ghazanfar, to Faith and Discipline podcast.
Thank you very much. Thank you for inviting me on this podcast.
Our first question is, what is acid reflux and what are the symptoms?
Acid reflux is a very common problem in population. About up to 40% of the people may suffer from reflux at some time in their life. So there are two types of reflux. One is when people have some heartburn when they have eaten something which doesn't suit them, and it settles on its own. They don't require any treatment. Okay. There is another type of reflux which happens in spite of not taking any untoward diet. They are eating normally, and in spite of that, they get heartburn almost every day. And this is something which one need to investigate and treat. And one of the main symptoms is heartburn, and sometimes people may have regurgitation of stomach contents, and sometimes people may complain of some reflux and soreness in the throat.
When you use the term heartburn, would you like to describe what heartburn is?
Yeah, heartburn is a sensation of burning in the middle of the chest. Some people may describe it as a discomfort in the lower part of where the food pipe meets with the stomach, and but most often people just say burning sensation in the middle of the chest.
Middle of the chest, okay. So what are the main reasons for acid reflux? Why it happens?
One of the main reasons is there is a sphincter, a mechanism between food pipe and stomach, which normally keeps closed, and it only opens when a person is swallowing food. But in people who suffer from reflux, that mechanism of sphincter closure doesn't work very well, and that sphincter is open most of the time. And normally, if a person has acid inside the stomach, they don't get any symptoms. But that same acid, when it comes back into the food pipe, they start having heartburn. And this is how the reflux happens.
When different people use different terms like heartburn, acid reflux, or indigestion. So are these all the same, or is there any difference?
Reflux and regurgitation are almost the same, but indigestion is slightly different. Indigestion sort of encompasses many other symptoms like discomfort in the tummy, in the upper part of tummy, in the stomach. Okay. They may have bloating or pain. So that comes into the indigestion. But reflux typically is in the form of heartburn and discomfort in the middle of chest.
Is it something like only happens in the older adults, or is also younger population also suffers from this problem?
This can happen at any age, and I've seen even some children having reflux.
That's interesting.
Yeah, but it's most common when you grow old. Yeah. What happens is when people grow old, or if they become overweight, then the mechanism between stomach and food pipe, which prevents the acid to come back to the gullet, that mechanism is weakened more often when we grow old.
So is it something to do with the food? Is there any particular food that causes acid reflux?
Yes, there are certain foods which can make it worse. People will have reflux, but when they eat certain foods, that will make them prone to have more reflux. And these foods are the ones which slow passage of food through the stomach. And these are mainly fatty foods with high protein content. And on the other hand, foods which are bland, like salads, they will improve it because they go through the stomach more quickly. But foods with protein and fat, they reduce the movement of food through the stomach.
So the food that takes longer to digest that causes the heartburn. Are there any serious health conditions other than heartburn associated with acid reflux?
Yeah, one of the main what we can call is a complication is if people have reflux over many years, they tend to have inflammation in the food pipe, and over the years it may lead to chronic inflammation, which lead to stricture or obstruction, usually in the lower part of food pipe. That is one of the main complications. But there is another one called Barrett's esophagus. Barrett's esophagus is a condition where people who tend to have chronic reflux, normally the lining in the stomach is different compared to the lining of the food pipe, esophagus. And when people have chronic reflux, that lining of the stomach grows up into the gullet. And that's the other name for that condition. It's Barrett's esophagus. And people with Barrett's, they have a slightly higher rate of developing cancerous tissue in the esophagus. And that's why it's very important to know about that condition. And people who have reflux over a longer period, they should have a gastroscopy.
How can we find out if what is the problem, whether it's Barrett's esophagus or is it just the normal acid reflux, which can be bearable? So are there any tests which can be done to diagnose the problem?
Majority of people in a younger age group, if they have reflux and it's very occasional, then they don't need investigation. They may just need to change their diet or take some anti-acid like Gaviscon from time to time. But if somebody is going into the older age and if they have chronic reflux, then they should have a gastroscopy, and that's the only way to find out whether they have a Barrett's, whether they have just high inflammation. And there is another condition which makes people prone to get reflux, and that's hiatus hernia. Hiatus hernia is a condition where the sphincter between the stomach and food pipe, esophagus, is loose, or there's a diaphragm, which is a muscle which separates abdomen from the chest. And that diaphragm has a hole, and that hole gets widened, and part of the stomach moves up into the chest. So that's called hiatus hernia, which is one of the main reasons for having high reflux. And Barrett's and hiatus hernia, they are usually diagnosed with a gastroscopy.
Is this like a manageable disease, can affect the quality of life of the person?
Yeah, this is a condition where uncontrolled reflux, and that can have a very sort of bad or worse outcome on quality of life. And because it becomes as a lifelong condition, and anytime they eat or sometimes even without eating, they will get heartburn. So these are the people who will need definite treatment, because if without treatment they will have a poor quality of life.
So we have seen some cases coming to hospital with chest pain. So they believe they might have angina, something related to the heart problems, but it turns out to be acid reflux. So how a person can identify whether it's something to do with the digestion problems or whether is the chest pain?
One of the less common symptoms are, I would say, a rare symptom of reflux is chest pain. And if somebody has persistent chest pain, then initially they should have investigated to make sure that it's not pain coming from the heart due to angina. So one should see a cardiologist, and if that investigated has found that the cardiac investigations are normal, then they should be seen by gastroenterologist. And sometimes people with reflux may have a spasm in the esophagus, and that can lead to chest pain. And if that is the case, then it will need to be treated with anti-reflux medication.
As you mentioned, food is the major cause of acid reflux. Is there something to do with lifestyle factors? Are there any other factors that can cause acid reflux other than the food?
One of the main factors for reflux is being overweight. People who are obese, they have high intra-abdominal pressure, which presses on the stomach and moves into the chest, and that deteriorates that sphincter mechanism between the stomach and esophagus. And obesity is one of the main reasons for reflux.
Okay.
And then there are certain other conditions like caffeine, smoking to less extent,
Okay.
and diet. These are the other things which can cause reflux.
Okay. This condition, is it just manageable? It's lifelong, or is it like a permanent treatment available?
If somebody has incompetent sphincter between stomach and esophagus, it will always remain incompetent.
Okay.
Because it's a structural defect.
Okay.
So they will need some sort of treatment. If it's mild, then diet can sort of maintain the symptoms control. If it's more than mild, then they will need some treatment. Initially, it will be anti-acid type of medication like Gaviscon. And if that doesn't help, then they will need to go on a stronger medication called proton pump inhibitors.
Right. So that was my next question. If someone is on PPI for long term, are there any side effects?
PPI is a medicine which initially, when it came into the market, there was a big scare that there are some side effects, because what it does is it reduces acid production to a very low level.
Okay.
And as a feedback, there is a hormone which helps to produce acid. That hormone goes up, called gastrin.
Okay.
And with the high gastrin levels, people may form some polyps in the stomach.
Okay.
And sometimes, very rarely, initially it was thought that it could cause cancer of the stomach.
Okay.
But PPA have been used over last maybe 35 years, and the side effects have been not that common. They are still very rare. All the polyps are more common, and sometimes they can happen even without PPI, but sometimes if somebody has been on PPI for a longer period, then they will form benign polyps in the stomach.
Benign polyps. Right. So would you like to describe what polyp is? Because if these polyps take place in the large intestine, then it can cause bowel cancer.
Polyps, they are just like skin walls. This is just growth of the lining of the stomach, and in the case of colon, it's growth of benign growth of the lining of the colon or stomach. In colon, polyps are different nature.
Okay.
They are called adenomatous polyp, which has a potential to turn into cancerous tissue.
Okay.
Gastric polyps, these are called fundic gland polyps. These are benign polyps, and turning them into cancerous tissue is very, very rare.
Okay.
So what we tend to do is, on gastroscopy, if a polyp is less than 10 millimeter, that doesn't need any surveillance or doing a repeated gastroscopy. But if a polyp is bigger than 10 millimeter, we may take some biopsies whenever we do the gastroscopy, and may need to do surveillance gastroscopy to take biopsies from those polyps.
So that's obviously you can tell as a physician by looking at gastroscopy if the polyps are there. But as a patient, can they see any kind of symptoms if the polyp exists in the stomach?
Polyps have no symptoms at all, neither in the stomach nor in the bowels. And sometimes, that's the reason, sometimes people do become anemic, because if the polyps are for a bigger size, they may lose tiny amount of bloods over a longer period, and people become anemic. And that anemia will need to be investigated as anemia, but polyps itself, they don't have any symptoms.
Okay. So as you mentioned polyps, can I also ask, does these PPI can cause stomach ulcers?
No. PPIs are there to heal stomach ulcers.
Yeah.
Stomach ulcers of two types. One is benign ulcer. They usually are related either with the Helicobacter pylori, and they can arise on their own.
Okay.
Second type of ulcer are malignant ulcers, so they need a different type of investigation treatment, but they usually don't cause ulcers.
Thanks for that. General population, they are looking for alternative medication therapy other than the traditional ones. Are there any alternative medication or therapies people can use if they are not interested in taking omeprazole?
If reflux is mild, then most of the people can control it with dietary medication, dietary interventions, eating a different diet. For example, I give my example. If I take 2 cups of coffee at a short interval, I will get heartburn.
Okay.
So if I don't take caffeine and if I don't eat curry twice in a day, I will never get heartburn.
Okay.
So I think this is what people can do. And the other thing is Gaviscon. This is something which these are called different types of there are different types of antacids, but Gaviscon is one of them. And this forms a gel on the food when we eat.
Okay.
And that gel stops the acid coming back into the food pipes.
Okay.
So this is another thing which can help. And third thing is lifestyle intervention, healthy eating, and if somebody is overweight, they should try to lose weight.
You mentioned Gaviscon quite a few times. So if someone is taking Gaviscon, obviously it goes into the gut. Does it interfere with the absorption of the nutrients, or does it cause any kind of side effect longer term?
No, it doesn't cause any disturbance in the absorption of nutrients, and it doesn't have any significant side effects to be known.
It is heard like high pH level of water can cure acid reflux. And there are some people who advise people to take high pH foods and high pH water. What is your recommendation? Is it safe to do so and someone should take it or avoid it?
If you ingest water with the high pH, it will stay in the stomach only for a little while. It will pass through very quickly. Food, on the other hand, if you increase the pH of food, that may help to neutralize the acid in the stomach. Because what medicines do is, for example, PPI, they just bring the pH of the gastric contents high to help with the reflux. So I think that is one thing which one may try.
As a herbal medical therapy, some people suggest to take ginger, like ginger water, or caraway seeds. Is there any kind of scientific evidence can confirm whether these are useful?
I'm not aware of any published evidence that it helps with the reflux. It helps with other gastrointestinal symptoms which you mentioned earlier, indigestion. Indigestion is usually in the form of bloating, pain, and discomfort. So these things do help with that type of indigestion. But for reflux, I'm not aware of any published data.
Then some people might have this problem while they are sleeping. So any sleeping position which is better to avoid acid reflux?
Yeah. One of the recommended advice is people who have hiatus hernia, they tend to have worse symptoms when they lie flat. Okay. So the advice is that one should raise the head side of the bed by about 20 centimeters. Okay. And that usually helps to prevent symptoms of reflux in the form of heartburn and regurgitation.
Does it matter whether they sleep on the right side or the left side or this?
I think there is suggestion that sleeping, I think it's on the left side, which helps to reduce reflux.
Okay. So that was quite good, informative conversation we had today. So what are your overall recommendation as a physician?
What I would suggest is this is a very common symptom, very common problem, and initially one should try to manage it with lifestyle advice. So dietary intervention, exercise, trying to lose some weight, and these 3 things definitely help with the reflux. And second is that if somebody has persistent reflux, they should not ignore it, because as a long term, if somebody has reflux over many years, it can lead to esophageal strictures and Barrett's esophagus, which can have severe consequences.
Okay. If someone is overweight and they are not motivated to do physical activity, exercise, and they don't want to change their lifestyle in terms of taking healthy food, do you reckon, is there anything we can advise, only one thing that can help them a lot? Or do they have to go through the whole regimen of changing the lifestyle and the food, everything altogether?
I think if they can't manage to lose weight, one thing I would suggest is, which usually helps, is just change their diet.
Change the diet.
Try to avoid fatty and spicy foods.
Spicy food. Okay.
That usually helps, and just change the way they sleep at night.
Sleep at night. Okay.
Because if these treatments like medicine or dietary intervention doesn't help, then the next option is going to be surgery.
Surgery, okay, right.
Which very rarely we do advise.
Right, okay. Thank you very much, Dr. Ghazanfar Ali, for your time. It was very, very informative session, and I believe our viewers have enjoyed as well. Thanks for watching, viewers, our podcast today. If you like this session, you could share with your friends, and you can subscribe to this channel. In future, we are planning to do this podcast live, and we would like to take your questions live, and then we will try to help you as much as we can. Thanks for watching.